While a psychosocial hazard is unique to the experience or perception of an individual, a culture of psychological health and safety is an organizational issue that requires organizational attention. We'll talk with a public sector psychologist about their efforts to help others feel safe on this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. Safety at work is more than freedom from physical injury. To be safe, you have to feel safe. Join us each week as we discuss psychologically healthy and safe work in the USA. Well, welcome to this episode of the Psych Health and Safety USA podcast. I'm your host, Dr. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, and advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. And this episode is an interesting, almost reunion. The last time that I worked with this episode's guest, he was completing his master's degree in a program where I just happened to be one of the instructors and the program director. As a matter of fact, I was looking through my records recently, and I might even send it to you if you're interested. Have a copy of the sign off to get my guest off to his master's degree, and he certainly made the best of it. He just recently completed his Doctor of Philosophy in Organizational Psychology. So it's my pleasure to welcome the newly minted Dr. Andrew Holter. Dr. Holter, how are you today?
I'm doing great. Thank you for that introduction. I'm still getting used to the doctor part.
I too, it takes a little getting used to, but no, it's really great to see how well you've done for yourself. Again, we all have these folks. I guess I do have these folks. You have Facebook friends, LinkedIn friends that you kind of see who pop up there every now and then, and I was thinking before we started recording, I'm not sure, because the program that you were in was distance, if we've ever physically met other than a conference or something, maybe, but I just seem to remember your name and I go like, that Andrew Holter guy, he just seems to be a pretty sharp dude. and it's certainly played out. It certainly played out. Yeah.
It's been that was I don't know, maybe 7-8 years ago now. So
it's been 9 years ago.
Okay.
9 years. Absolutely. Like I said, I even looked it up just to make sure. So I find that the best way to get to know our guest is from our guests. So my first question to you is, who is Andrew Holter?
Sure. So I've got a pretty unique background, and kind of coming from that path where we met. I was completing fire science coursework and working on my master's in public administration. I've got a 18 year career now that's been very fire service centric, and I've had every role you can have in emergency services, from firefighter, paramedic to fire inspector. And I think as time went on, and I kind of grew both through experience and in education, I kept coming back to some of these themes that were problematic for organizations or for myself as I was, working in places. And it was during my time during grad school, while I was working for a rather large nonprofit, well-known standard development agency, where I really kind of got turned on to this idea of organizational psychology and what it would allow me to explore professionally. And so that kind of sparked this interest. And it's certainly a lot different than being a firefighter or anything that's related to it. But, certainly organizational psychology has a role to play in just about every intersection of people and an organization. So
the topic title moniker of this get together is psychological health and safety. And I from the definition that I use, that I picked up as a part of my research and in other resources, is that a psychosocial hazard is a hazard that is perceived or experienced by the person, and it's unique to the person as a hazard or as a threat. And I find that that's one of the challenges in a lot of particularly big organizations that we have, or we or they have these standardized approaches and ways of doing things that don't necessarily work for everybody all the time in every circumstance. And then when they don't work, we just do it harder. That's kind of the fire service way. So if you think about that whole concept of psychological safety, so safety outside of the physical environment, what does that mean to you when I say psychological health and safety? What does that mean to you?
Sure. For me personally, I mean, I think it allows it's that intersection of that person and the organization, where the two are operating, in a symbiotic relationship, and where that person gets to be themselves, they get to be authentic and genuine, and they are receiving in return for their work and their time there from the organization. They're getting some kind of value added to them, and that organization's conveying that and doing so, in a proper manner that always goes way more beyond compensation and things like
Mm,
that. Those traditional senses of, I'm going to exchange time for money kind of thing. Um,
mm.
that's sort of what it means to me. That's a really simplistic view of
Sure,
it,
sure, sure. That's
but
important. Yeah.
but I think that even in my own work, um, recently, as I've been put in a management role in a local government, I have a team that spans Gen Z up to baby boomers, and it's been very challenging. But it's made me one heck of a manager with them, um, to be in that kind of a role. But you can see how, the kind of, to your point, those individualized needs are present for each different person, and you can't really take this one size fits all approach to management, or even kind of to an organizational culture perspective. You have to take an individualized approach and know that each employee has different needs and different values that they're bringing to the workplace.
Sure, sure. So you did your doctoral research in organizational psychology. Can you share a little bit about your research, the type you did, and what tell us a little bit about your research.
Sure. So the title of my dissertation was, "Does Grit, Self-Efficacy, and Job Satisfaction Predict Turnover and Tension Amongst New Nurses?" And when I started developing and doing literature review for this, it was pre-COVID, and and then,
Mhm.
the pandemic happened, and that it really complicated things for me, for trying to get participants, and that met all the criteria. And so, kind of, one of the first big things that came from my research was that, um, I was trying to find this information from registered nurses in particular who were working in patient care roles, mostly because they are the literature shows us that they're the ones most at risk of reality shock and transition shock as they go into their careers, and they're more likely to encounter stressors that would result in things like burnout. So, in looking at that group, I had 405, I want to say, registered nurses, sort of in my pipeline for that survey, and only 71 participants were working with patients. So, out of those 405 registered nurses, only 71 were working with patients or in a patient care role. So, to me, that was extremely shocking. I didn't anticipate that at all. Um, and It was kind of outside the scope of the research problem and everything I was trying to find, but that was pretty enlightening. As far as the research problem itself goes, what we found, I was trying to find if personal resources played a role that was just as important as something like job satisfaction in the turnover process. And Instead, what I found was pretty interesting. My sample was rather dissatisfied. Uh, they had an average mean score that was dissatisfied with their work, but they had a really high grit score,
Hmm.
and those two things intersected to predict turnover intention. So the grittier they were, the more likely they were to have turnover intention, which I found
So
really interesting.
I've certainly heard that term grit before, but tell me a little bit more about, what does grit mean? What is that? Is it kind of like the movies, or is it something a little bit more in depth than that?
Yeah, I think you can think of it candidly like like the movies. It is a newer construct that's been kind of floated out since 2007. Was some work from the principal creator was Angela Duckworth, and there's two really components to it, and it's a passion and a persistence component. So I have the passion to pursue, and I have the consistency or the perseverance, so that if there should be an obstacle or something that comes up in my way, I'm just going to keep pushing forward because I have that persistence aspect of it as well. And so my thought was perhaps efficacy or grit, which hadn't been examined together in a study like this before. Maybe they would insulate uh, new nurses from everything that they're experiencing,
Mm.
and instead, it actually kind of the grit anyway sort of propelled them to be able to say, you know what, I don't like this job. I'm going to go figure it out.
Mm.
I'm gonna get a better situation for myself. So I found that really interesting.
So you're suggesting then that those with more grit were the ones who decided to do something else, or to push back against the environment, or exactly how did those two factors interact?
Yeah, so it grit really positively predicted turnover intention, and
Okay.
so grittier they were, the more likely they were to have turnover intention. But it was also a very dissatisfied group, which isn't uncommon to find among new nurses. Which
Sure.
is I looked at that group. New registered nurses tend to have very low satisfaction levels with their job compared to other healthcare fields, or even just other professionals. So that was a my group had a really low mean score.
Hmm.
Be some environmental things like the time that the data was collected, which was the fall of last year.
Right.
We were still uh, kind of reeling, I think, with COVID and everything else that was going on at the time.
Right. Right. Yeah. That's certainly it's a life changing, history changing event. And, we all saw a lot of people, deal with, survive, or get through the pandemic in very different ways. Can, can, can you talk a little bit about what that was like, even with the group that you supervise in your, in your current role, having to help people through what's, again, it was a very, and it still is. What I share with people is I'm personally not convinced we will ever go back to pre-pandemic. I don't. I, I I don't know that folks agree with me on that, but my personal opinion is I don't think we're ever going back. I think there will be some things that will approximate what it used to be, but this is just a very new world. And there's some folks that just aren't going to go back to that. They aren't going to go back to the offices. They aren't going to go back to those jobs again. They're just not. They're not interested. And to the extent we have the opportunity to think about this in a new way, I think that's better, but that's just me. But I think this was it was I'm sure it was a struggle for a lot of people, because those of us who've been in emergency services and such have seen all kinds of cataclysmic things happen to isolated groups of people, but everybody was going through it at the same time, and we all had to kind of get in there and make our best. So what, have some some thoughts, or would you be able to share some of the things that happened while you were helping your group through that?
Sure. And I mean, actually, at the time, I was working as a contractor
Okay.
for the federal government. And
Okay.
unfortunately, I was working with the Department of Veterans Affairs in health
Mm.
nursing. And so when March came about of 2020, that was it. the Department of Veterans Affairs took a very tough stance on protecting the veterans and their vulnerable populations, as they, certainly had a right to. And what that meant for me was, and personally for my family, was that our main source of income ceased.
Wow.
It was certainly a big shock for us. And um, I went back on the truck. I went working on the ambulance and on a fire truck and everything else for quite a time, in those probably that first like 6 7 months,
Mm.
until we sorted it out. But it was uh, it was it was something, and I agree with your thoughts that we're never going to truly completely erase that from our memory. Just like any kind of trauma, uh, there's long lasting impacts that are intangible. And I think those will live with a lot of us forever. And I think there is behaviors and things and modifications that are permanent for a lot of people.
Yeah, it's akin to me to saying that the greatest generation is going to go back to pre-World War II, or that that the millennials are going to go back to pre 9/11. I just such a collective impact. I just don't see it. I don't. And as a matter of fact, again, these are opinions on my part. I have to be honest about them, but even the effort to try to do so and get there is more stress, because you just can't, like right now. My wife and I, we wear masks every place we go, when particularly when we're people that we don't know, because it's just become a thing now. Now the reality is I haven't had the flu in years either, so there's some benefits, but it's changed some of the things that we do, and I don't think we're alone in that. I just, and again, it's an adjustment. It's adjustment. It's a new world. It's kind of what's going on. So again, from when you think about this organizational thought process psychology thing, how do you go about helping a group of people make a transition like that? Or what does that look like, trying to get an entire organization to shift the way they think, or at least be aware of the way that they're thinking?
Well, I think that that's truly what the struggle is right now. And, whether good or bad, I think that it's kind of become, folks like myself, it's become a moment for organizational psychologists to finally shine, especially here in the United States, where, um, you know, the mass opinion is that the field has been fairly underutilized. Um, and, I think it's a good moment for us to be able to help organizations identify where these weak areas are. Uh, is no more is it just about the work week and benefits and things like that. People are really looking at work differently and their relationship to work. And I think that's why we still see labor market issues, and we still see folks in places that can't fill jobs. Uh, it's a it's not necessarily like retail or things like that are a bad place to work. It's just folks have a different have shifted kind of that value and time and money equation looks a heck of a lot different for a lot of folks. And organizations need to give people a reason to come to work, have value, and that belongingness maybe. And certainly to our discussion here, that organizational culture and whether or not they're looking out for that's the psychological health and safety of their employees is super paramount to being able to move forward in this new labor market or work environment, whatever you want to call it at this point. But, it's
Right.
definitely different. And again, to your point, that we can't put it back in the bag. Like this is it. Uh, People view work differently.
Mhm. So, in your, again, organizational psychologist role, what are some of the easier conversations? You'll get called. That was easy, and that are a little bit more complicated. If you can pick a couple and say, "Hey, these things can be fine, but these things, oh my goodness!" Just a couple of examples from your perspective.
Sure. I Unfortunately, and that's part of our branding issue, is like nothing we touch is ever too easy. So And kind of going back to some roots in occupational health and safety, and we look for root causes to things, and you do like that root cause analysis. A lot of times I find organizations have fairly complex issues that are fairly easy to talk about, but very difficult to fix because they require real big changes. Things like clear roles and responsibilities, accountability, and things like that. I find probably one of the most common issues is accountability avoidance, and and that is like a it's like a festering infection in organizations that just pollutes and turns good employees bad. It's a very quick disengager. And so when you have bad employees that are kind of getting along just fine and good employees are seeing that, it's a super quick way to kind of turn the engine off, and everybody kind of wants to unplug from that. So those aren't easy things to fix generally.
Hmm.
Uh, when you're talking about trying to shift uh, an organizational culture that becomes more accountable, where people take sort of ownership or pride in their projects, um, and there's clear expectations for everybody out there, and that's well communicated. That's kind of my like foundational approach usually, is to look for those pillars and say, if those things aren't a problem, then what else is happening in the organization that's creating an issue.
So do you find yourself working with the entry level folks, mid level folks, the folks at the top, or just depends on the issue?
I really everybody, and I kind of equate it to and ironically, we're going through this at my workplace right now, but we're in the middle of a strategic planning process, and you get almost kind of like a focus group approach. You get stakeholder committees together and you gather input, and it's an extremely fun exercise to hear the same types of themes come in from all these different groups within an organization, and you're there to try to thread that needle, and that's when you're bringing that information to the steering committee or whoever's in charge of that organization to say, hey, we met with the frontline staff, we met with your supervisors, we met with your managers, and I'm coming to you with to let you know that pretty much everybody thinks that accountability is an issue here, and that nobody's really being held accountable, and they want to see some leadership. They want to
Mm.
see the management out on the floor talking to folks and getting that ground truth, and and doing those kind of things. So for me, it's usually a snapshot of the entire organization, kind of like a sample uh,
Mm.
of it to get real true ground truth feedback on things. But generally, you end up hearing very similar things. They might say it very differently because their perspective, from where they sit, is totally different. But when you look at the causes behind what they're saying, it generally you end up coming back to usually one or two common root causes.
Hmm. And so common causes, and you said something really profound earlier about how, there's these issues that uh it's easy to have conversation about them, but it's much more difficult to actually do something about them. And what's your, what's your general thought about some of the reasons behind the difficulty? Because you get people, most of them, nobody hires bad people. Nobody goes out and hangs up a shingle and says, I want bad people to come work here. So that can't be it. Nobody wants unqualified people. We have, there's tests and there's all these things, educational. So it can't be that either. So what is it? I mean, just what is it? So if you have good people with many times good intent, but it just seems to be hard to, to make the switch. What's your thought about why it's so hard?
Sure. Well, change is difficult, right? Whether it's as an individual trying to kick a habit, or a collective group trying to do something completely different. And I think for some teams and some organizations, it comes maybe a little bit more naturally. where you have things like, psychological safety, and people, you can get in a room and they're gonna be themselves. They're gonna let stuff fly. Everybody feels comfortable with it though. And when we come out of there, we've made a decision. We're unified in it as a team, but we know where everybody stands. It was made clear. Um, Sometimes that happens real natural for folks, and other times it's really difficult to go into a group of managers or whatever the case may be and be candid and have those real frank conversations, and then get those people to act on on that back in those real conversations, because it's not fun. Um, especially if you are the servant style leader, the
Mm.
transformation, or you're authentically, practicing your authentic leadership, and you're an empathetic person, and you generally want to lift people up and do good. It's hard sometimes when you have to kind of be the rule person and
Mm.
to break to that side of it. But I think that's the balance sometimes that is missed in leadership when we talk about it from a real theoretical perspective. When we talk about transformational leadership, and sometimes you have to have like a good conversation with somebody about what's going on and what's their performance, maybe if there's an issue and things like that, and you have to be willing to go down that road all the way to the end of it. To your point, I don't think organizations hire bad employees, but there are people who get into places and they get exposed to processes, or they get exposed to maybe the parts of the organization that aren't working well, and they burn out, or they disconnect and they become disengaged from it. Um, and it's hard, if you're in one of those situations, it's hard to be motivated to want to do a good job.
Mhm. So, talk a little bit about there is often a lot of attention paid to the individual who is not showing up for work on time, that is, the performance seems to be slipping, or whatever the case. And so we sit down, we have the performance, discussion about getting better and all that. But can you talk a little bit about the system itself that we put these people in? Because it goes back to my point. I just don't believe that most organizations go out and hang up a shingle and look for bad people. And that same person that was in their first year of training or whatever it was, they seem to be really highly motivated. And somehow every person we send to that work group or into that environment seems to come back, you know, not performing to the standard that we would like. So what conversations or kinds of conversations do you or could you have with folks? It's really the system we put them in as opposed to the people themselves.
Sure. Yeah, I agree with that. Yeah, I think that, again, it kind of goes back to that first thing we talked about with looking at the individual, and having an individualistic approach to your organizational culture. And I definitely do that as a manager myself. It's sort of my authentic leadership approach. But each person needs different things. Some people need a lot of autonomy and they soar in that environment. Other people need some guide rails and some deadlines and some guidance. And if you put that in place for them, they're going to do great things. So it's trying to find that balance that everybody needs, and being respectful of it, which is kind of comes back to the theme of psychological health and safety, and respect for the individual, and treating them as a human being.
Mhm.
And I, I think that that's the part that it's very intangible, and a lot of times organizational psychologists get accused of being too academic and like out there in outer space with constructs that nobody knows what the heck it means. Organizational citizenship behavior, like what is that, what am I doing? It's and so we lose the ability to really get organizations to buy into what we're selling. But really, we're, I think, most of the time you can boil a lot of our research down to saying, like, treat people with respect and, have a respectful workplace, hear them, listen to them, value them, and they will inherently, more likely than not, value you as an organization and their employer then.
Mm, mm. So there is often conversation about the importance of leadership in general. You mentioned a couple of you know, the the views that folks have around leadership, servant leadership, transformational, what have you. So if you had a room full of all leaders, folks who say they want to be leaders, folks who think they are leaders, uh, from an organizational psychology perspective, what are a couple of things that you could share with just a group of leaders to help that organization move in the direction it should be going?
I think the first thing is to listen and be present. Yeah, I think something that anyone that's in a leader role, whether you're a frontline supervisor, or somebody that's over a region, has multiple divisions of something reporting to you, we forget that we have a presence, and we forget how important our presence is, especially to the folks that report up to us. And a lot of times folks just want to be heard, and they want to see that you're present, and they don't mind bending your ear for a minute. um, I joke about this at work all the time, but we go, people come into my office, or I stop by and say hello to them, and we end up going down the rabbit hole of something. But we end up exploring, maybe an organizational issue or a challenge that they're having. And, through those conversations, I get to learn about them, the employee, how they think about things, how they see the organization. And likewise, they get to see that about me, because I try to be very candid with them and with everybody I come in contact with. And so, that would be my direction to them as leaders, is just listen and be present for your employees, because that's truly what they want from you. And if they feel like they're being listened to, um, and you're on the tail end of that, hopefully you're taking actions or doing things that are in line with what they're telling you. That's going to carry you no matter what you're trying to do. If you're trying to be a servant, if you're trying to be transformational, if you're just trying to, you know, post the best quarter that you've ever posted. If you're listening to your employees, that's how you're going to do it.
Mm, absolutely, absolutely. So you're now that your research is completed and you're kind of settling in, at least I assume you're kind of settling in with a new title and all that type of thing. So where do you see this taking you in the future? I mean, in terms of being able to apply what you've learned in your research.
Sure. I mean, so I'm definitely trying to get my research pared down a little bit, and get it out there into some publications. But I'm also trying to. I'm working with a group right now that we're trying to do a research study. We're building a proposal to look again at the nursing industry, more so in response to the recent case with there was a medication error. And so we're trying to kind of examine that a little bit further. And actually, psychological safety is probably going to be one of the things that we really dig into, and what nurses, what their perception is at work. Uh,
Mm,
does the organization have my back? Can,
mm,
I report a med error, or am I going to get in trouble and be charged
mm.
criminal for it? So those are some things that we're really interested in kind of further exploring right now.
Wow. Yeah, the healthcare industry as a whole, it has some, as you well know, has some really, really high rates of all kinds of injuries. And those are the physical ones. And because we in the United States don't, unfortunately, we there are a lot of people who don't seem to be as concerned about the psychosocial injury exposure. They just don't, and don't seem to recognize it until it becomes an error in the person's performance, or, God forbid, some form of violence. The folks in the healthcare industry are exposed to some really, really significant and frequent instances of workplace violence. And there's a conversation about some federal legislation. I think one of the states, California, if I'm not mistaken, is further down the road. Either they have passed or talking about passing some specific legislation to deal with the healthcare industry. But there's a part of me that says they're not the only ones, because, in our, joint experience in fire rescue service, the patient in the hospital generally start out on the street somewhere, and they may have been, their emotional state may have been even more severe prior to getting into the confines of the hospital. So, yeah.
Yeah, I haven't gotten into research specifically with EMS, and as as somebody who's trying to be a researcher and stay professional, I can't remove my bias enough from that industry to act. So, but on a personal level, I mean, I have known 3 EMS providers that have taken their own life that I've worked with, and it is such an underreported issue. And to your point, yeah, we just continue to not recognize it like we should. Even in the fire service, things like, we've really taken to heart our cardiac health, and we've really taken to heart our exposure to carcinogens now and our risk of cancer, but we're still really ignoring relative to those things, the mental health aspect of our professions.
Absolutely. Yeah, I'm again pretty convinced that we are not going back. We are, as much as people want to have conversations about, the lack of safety in communities and all that type of thing, we are safer as a species now than we were 300 years ago. We just are. I mean, the chances of somebody just walking down the street and having a duel in the middle of the street is pretty limited, despite all the, the other things that go on. The difference is now we just hear about it quicker. But I'll say, as the physical environment becomes safer, automation, better technology, better, engineering, that type of thing, I think what we're going to be left with is more focus, or necessity to focus on, the psychosocial exposure. That's what's left, because until we take human beings out of the equation, which I don't anticipate happening in either of our lifetimes, I just don't. And whenever human beings are interacting, there's always that possibility that, you say something, I feel something, we have some conflict. It's human, it's natural, it's normal. But it seems like it's just very difficult to talk about, which is just kind of funny to me that we can't talk about something that we're all experiencing at the same time. Yeah. So go ahead.
It has come up in our strategic planning at process with the fire department here, and that we need more access to mental health services, but there is still a stigma attached to if you're the one that's trying to go find those services or seek that service. And I find it interesting. I was talking about generational differences, and younger folks don't seem to have that nearly as much, and so they're pretty open about talking about, hey, I'm not feeling quite well today, and they're not necessarily talking about like a stomach ache. They're talking about their mental health, and so that's a good thing for sure. And it's kind of refreshing to have that exposure to some of those Gen Z folks and even some millennials that are in that category of being able to share that, whether it's with a coworker, a friend, or whoever, kind of take the taboo away from it.
Yeah, I agree with you 100%. I see, even, in many of my friends that are millennials, I have lots of millennial and Gen Z friends, to be quite honest, because they're exciting to me. They really are. Some of my baby boomer friends are just kind of boring to me. I like them, but they're just kind of boring. I know what they're going to talk about. It's going to be the same thing we talked about last time. And so I have to go to different groups and have different conversations, but it's refreshing to see people who are just out with it. I mean, this is how, and again, we are all feeling it. Some of us had been enculturated to not say anything about it. It comes out in our actions later, but they're just saying it. And I think it's very important that, the system start to recognize that in the private sector, if you want to recruit good people, high quality people, people with great expertise, recruiting them is one thing, retaining them is something altogether different. If you, aren't allowing and having that kind of environment where people can express how they feel, and the ability to be able to bring your whole self to that enterprise is just so important. And I think the same thing applies to, to the public sector as well, that you're not going to be able to keep good people, if they don't feel like they can be themselves and express themselves and, and tell you what's going on with them. I just think it's very important. Very important.
For sure. I mean, we have, I'm part of a international hiring and recruitment roundtable for fire services,
Mm.
and it is across the country, and even in some not across the country, some overseas fire departments and organizations. We haven't really, public safety has really never dealt with a labor market shortage or a labor shortage like we're dealing with now, and it's pretty profound. Even when I was testing to be a firefighter 15 years ago, it was nothing to have 1,000 people show up to try to get 10 jobs. And just recently here, we were hiring about 20 and we had about 150 apply. So
Wow.
it is
Wow.
it is
Wow.
remarkable.
Wow.
It's remarkable. And we're experiencing it on that end, but we're experiencing it on the other end too, with people shopping around and looking and kind of thinking like, is this going to be it for me? Am I going to spend
Mm.
25 years here, or am I going to I'll be here for 5 and then I'll find something different to do with my time?
Sure.
And maybe it's because they're not getting that value that we talked about. They're not being heard, and they don't feel that ability to bring their whole self to work every day and be valued for it.
Sure. Sure. So, as we, start to come close to the conclusion of our conversation, so what about, outside of your professional pursuits, anything interesting coming up in life? I understand there's a little one.
Oh yeah. She's getting bigger by the second, but she's 17 months old now, and it's always a hoot. Definitely being a parent has been eye-opening. You always hear, as a millennial myself, we always heard our Gen X parents talk about it, and you're like, yeah, like I'll figure it out. And as the father of a daughter, it has certainly kind of reframed some of my perspective on the world around me and things. And talking about mental health, I mean, there was definitely a time in the months after her birth, both my wife and I struggled a little bit.
Mm.
And it's sort of a lesser talked about thing for men in that role as a dad, but it was tough there for us, whether it was all the sleepless nights and everything, and kind of trying to find ourselves in that mess, but sort of finding your grounding again and your footing, and seeing yourself in that new role. It can be a challenge for sure, whether I think whether you're a mother or a father, and especially depending on what examples maybe you grew up with at home. But we're definitely in a much better spot now than we were. So that's good.
Right. So, any last thoughts you want to share with folks who might be listening, and some actually might be watching? Any closing thoughts you want to leave with folks?
Sure. I think that the big takeaway, we kind of talked about it. You sort of drew me to that, is to find that respect for people, to listen. I'm a big talker, obviously, if you can't tell. And so for me, I always tell my folks, like, if I'm talking too much to you, you've got to tell me. Like, tell if you're busy, tell me to get out. Tell me, like, to go back to my office or whatever the case is. And we have that relationship, and that's it took a couple months to establish that genuine authenticity, like I talked about. And yeah, I think that that's what people want from the people that they work with and that they report to, is they just want someone that cares about them, that values them, and that place comes from an authentic place in them. So listen to your people, do right by them, and you'll have a successful organization.
Sure, sure. So if people have, questions, want to follow up with you, what's the best way to get a hold of you if folks want to follow up with you?
Sure. Well, I'm super busy on LinkedIn, so you can
Okay.
certainly find me on LinkedIn there.
Mhm.
And if anyone has any questions or follow-ups or anything like that, find me on LinkedIn
Mhm.
at Andrew Holter, and I will certainly reach back out to you.
Sure, sure. Well, Dr. Holter, I just love being able to call you. I swear that's it's a very cool thing. Just really proud of the progress that you've made, and it's wonderful to see, the progressions that people have in life, and for a young guy to be able to get as much of this done as you have, it's just very impressive. And it's good to hear about, family, becoming a dad, and it's just wonderful. It's a wonderful thing. And I certainly appreciate you taking time to hang out with us here for a period of time. You really dropped some nuggets here today. You have, but just really, there's some things that I'm going away from it thinking like, wow, I hadn't heard it quite said that way. So thanks very much for sharing your expertise and your research with us. And I'm sure we'll have future conversations. I'm certainly following, as best I can, following you on LinkedIn and other places. It's a good environment, and I like to encourage, others to do the same. You can certainly follow me as well on Psych Health and Safety USA.org or .com. That's our website. You can see all of the episodes of this podcast, and you can follow me on LinkedIn as well. Stay pretty busy out there. And our friends at Flourish DX, please follow them. We're a family of podcasts. There are folks having this conversation actually all over the world. And we're honored to be able to be having the conversation here in the United States, with the hope that, people understand this is a thing, but it's a thing that it is easy to talk about. And as you said, difficult to do something about, but I think we can do something about it. And we're going to need great people like you to be able to do that. So again, thanks very much for joining us. Thanks very much for those of you who are listening or watching in, and stay tuned for the next episode of the Psych Health and Safety USA podcast. Thanks very much. You've been listening to the Psych Health and Safety USA podcast. To stay up to date with the best content on workplace mental health in America, subscribe wherever you listen to podcasts, and join the Flourish DX community at www.flourishdx.com.